Well, good morning. We are here at Hancock Oral and Maxillofacial Surgery Center. Did I get that right?
Yes, sir. You got it.
I've got Dr. Ishmael with me. How are you today?
I'm doing very well. Thanks for having us.
Well, thanks for being here. So today we want to talk about wisdom teeth.
All right. That's an interesting topic.
The wisdom teeth. First of all, tell us what you do here.
Well, we are a practice composed of 3 board-certified oral maxillofacial surgeons, and we treat a range of problems that can occur within the mouth, including the soft and hard tissues. So basically, we take care of anything from bad teeth to trauma to the jaws to pathology, corrective jaw surgery, TMJ problems. One of our biggest things that we take care of is wisdom teeth, which can cause a lot of problems for people down the line.
So a step past the dentist.
Yes, more narrowly focused on surgical procedures for patients inside their mouth.
So you're the one that the dentist refers us to when the dentist is like, it's a little more than a teeth cleaning.
Yeah, if they think this might be something that they don't want to deal with or is difficult to deal with, we'd be the people on the speed dial for that.
All right, so we're going to chat with you, like I said today, about wisdom teeth. So, I mean, tell us about wisdom teeth. It seems like they're like the teeth that you don't need, but we still have them.
Right. So it's interesting. They are a little bit of a nuisance, and they're not very useful. So wisdom teeth are typically the last teeth to erupt within a person's mouth. Unfortunately, they're also the most likely teeth to be impacted. Impacted means that the tooth cannot make it out of the bone and gum tissue into the mouth into a functional and cleansable position. So that is really the crux of why they're a nuisance, is because they don't come out into the same spots that your normal teeth do.
Cleansable position, that's the key piece that I think I heard. I literally just had 3 of mine removed maybe 6 weeks ago. And that's the thing, it's like the top ones were in, they were fine, but they're just like you can't get to them. It's hard to get to the back side of them.
Very difficult to reach, and that's if they come out in a good spot. A lot of people, no matter what they would do, would be physically impossible for them to clean some of these teeth, pending the position.
Sure, it was my bottom left that was like pushing into the tooth in front of it, kind of like what I see on this shot behind us.
That's right, that's how they look.
And then of course, it wasn't causing a problem now, but it's just a ticking time bomb. It was pushing into the other tooth, which then had like a cavity below the gum line, and needed a crown, the whole 9. So when do we have to start talking to our families about that? And when is the time to start thinking about having them removed?
Perfect. So the time to consider wisdom tooth removal really is in your teenage years, anywhere from around 15 to 17, 18 years old. Most people get these kind of taken care of either right before they go to college, some point in high school, or maybe in their first couple of years of college. And that is generally the time frame that we're looking for. The reason for that is it's before they cause a problem. It's before they're completely developed. So we can see them intercept a problem and treat it when it's the easiest to be treated, both due to the difficulty or the lack of difficulty with removing the tooth and the ease of recovery for the patient.
What are some of the major problems that they cause?
So wisdom teeth can cause all sorts of problems that you wouldn't imagine. So one thing that they can do is they can damage the teeth that are next to them. They can kind of burrow into them and damage their development. They can also cause cavities and bone loss on the teeth next to them. They can cause big infections that might land a patient in the hospital. They can also have cysts develop around them when they're impacted that can erode the bone of the jaw and cause much bigger structural problems for your lower or upper jaw.
I had one dentist tell me when it was time to get them out, you want to get these out now instead of later in life, because when you're older, you want to be worried about hips and knees and not teeth.
Exactly. That's exactly the mindset to have to that. They are much easier to address when you're in your teenage years, and your recovery is like a snap of a finger.
That's key. It was the recovery piece that I think is really the most important for me. It wasn't horribly bad. It wasn't bad at all, actually. It was just the first couple of days afterwards, it was sore. But I don't remember much, so I can't imagine. I do remember the top 2 just kind of like, they just came out. I could hear they kind of made a grinding sound. They came out. The bottom one had to be broken a bit. This one over here I got rid of years ago on a cruise ship. It's a story for another day. You can imagine. There was a dentist on the ship though, so I was working on board. But so tell us, we mentioned evaluation and treatment. The best time we're talking about teenage years. Early college years, but what if, is it a problem if you get like I'm in my late 40s? Is it a problem as you get older, or is it just you're just delaying the inevitable?
The problem with when you're older is that some of the damage to the adjacent teeth or the bone in that area may have already been done, and by taking them out at that point, you may not get a full regeneration of what has been damaged at that point in time. So if you want to prevent a problem, the best time to do it is before the problem, and that is why teenage years make the most sense. Of course, we certainly treat people at all ages, and anyone who has a problem at any point in time is obviously very welcome in our practice to be taken care of.
So let's talk about the process. When you come in to have the procedure done, what does that look like for folks that are interested?
So the first thing we do is we actually meet the patient prior to the surgery and review their medical history, perform a thorough oral examination as well as a radiographic examination so that we know what kind of problems could be on the horizon, as well as the position of these teeth relative to the adjacent teeth, to the nerves which can travel through the jawbones, as well as other anatomic structures such as the maxillary sinuses. So we try to tailor our treatment to avoid any sort of damage to anything that we don't need to be around while we're doing this, and to figure out what the most appropriate treatment for the patient is. Sometimes we don't remove the entirety of the tooth if it's too close to structures that we don't want to inadvertently damage during the procedure. So we meet the patient, get to know them, and tailor a treatment plan to exactly what their needs are. And then we schedule them for the surgery, which we typically do under full intravenous sedation, which would result in actually not even remembering anything. I know when you had yours out, they did a little bit of a lighter sedation, but not everybody can tolerate that. So what we do pride ourselves in is being able to make it to where you don't even know that we did anything during the procedure. And we do have some tricks that we can use also to keep you as comfortable as possible afterwards as well.
And then when it's done, the procedure's over, and it's time to care for, what's left. How does that look?
Well, we try to make sure our patients stay on a softer diet for the first week after surgery, excellent oral hygiene. We like to make sure you ice your cheeks afterwards to help minimize any swelling or problems that you might have afterwards. We also can use this long-lasting local anesthetic with latches for up to 3 days after administration. So where we make the incisions to get these teeth out can be numb for up to 72 hours after the procedure, so you have a really nice kind of landing spot after the surgery.
That would have been great.
Yeah.
I did not have that soft landing. It wasn't bad. Ibuprofen was all I really needed, but well, that's good to know. So if you have folks out, if you're listening, you're watching, and you have issues with wisdom teeth, maybe you've got kids that are coming up at that age with wisdom teeth, give the guys here a call. It's as simple as just getting in for a routine exam.
If you give us a call, we'll find you a spot that's convenient for you with any of our doctors to get you taken care of in the time frame that you need to be taken care of.
Yeah, you want to make sure that you're getting ahead of the game. He just said you want to avoid anything that could be going on later in life to cause other issues down the road with anything else that's going on in your mouth. Give them a call. You see that number at the bottom of your screen. You also see the website. They'll get you taken care of. Dr. Ismail, thank you.
Appreciate it. Thank you so much.